WMAR-2 News begins now with breaking news.
All right, we're going to take you live now to Annapolis to get the latest from Governor Larry Hogan on the metrics here as far as the COVID-19 is going in our state. Let's listen in.
Milestones in our COVID-19 vaccination campaign, including our first day over 75,000 vaccinations. And today we hit more than 3 million vaccines. We completed the first million vaccinations in 67 days, then reached 2 million 27 days later, and now in just 19 days we did the third million. We administered 429,317 vaccines in just the past week alone. Our average vaccination rate is 61,331 shots per day, which means we're vaccinating at a faster rate than the nation and 36 other states. 4 months ago, vaccines had not yet even been approved by the FDA, but now we have already vaccinated more than 76% of all Marylanders over the age of 65 and more than 42% of all Marylanders 18 years and older. As a result of the infrastructure we've built across the state and our rapid pace of vaccinations, along with the increased supply of vaccines from the federal government, last week we were able to open pre-registration to Phase 3, meaning that every Marylander over the age of 16 was able to pre-register for an appointment at one of our mass vaccination sites. More than 500,000 people have already done so. Today, we are pleased to announce another acceleration of the vaccine eligibility phases to earlier than anticipated. Any and all Marylanders 16 and older are able to get a vaccine at any of the state's mass vaccination sites beginning tomorrow morning. And by Monday, April 12th, all providers in the state will be required to allow vaccines for all Marylanders 16 years of age and older. Appointments for any remaining individuals in Phase 1 or Phase 2 will continue to be prioritized. And Marylanders 16 or 17 years of age will only be able to utilize clinics that are providing the Pfizer vaccine, as it is the only one that is currently approved by the FDA for ages 16 and older. We will open 3 more mass vaccination sites this week, including the FEMA site at the Greenbelt Metro Station in Prince George's County, the Maryland State Fairgrounds in Baltimore County, and the Montgomery College campus in Germantown. Next week, we open them at Frederick Community College and at the Navy Marine Corps Memorial Stadium in Anne Arundel County. At Ripken Stadium in Harford County the following week of the 19th, and at the Mall in Columbia in Howard County immediately after that. Friday, we successfully launched our first no appointment necessary walk-up line at the Eastern Shore site in Salisbury. Tomorrow, we will begin the no appointment necessary line also at the Hagerstown site, then next week at M&T Bank Stadium. In addition, we will be adding no appointment necessary lines at each of the other new mass vac sites that we are opening. We want to emphasize that the best way to guarantee a vaccine and to get through the sites faster is still to pre-register and secure an appointment. And we encourage everyone who wants a vaccine to visit covidvax.maryland.gov or to call the state's COVID-19 Vaccination Support Center at 1-855-MD-GO-VAX. We're also now providing vaccines at 481 pharmacies all over the state of Maryland. And the federal government is providing additional supplies to these pharmacies, which will also now be able to make more appointments available each week in every county. Pharmacy providers can all be found at covidvax.maryland.gov. I want to stress that even though we're opening up eligibility for everyone, that does not mean everyone will be able to immediately get an appointment. But with the supply of doses increasing over the next month or so, a vaccine should be available for everyone who wants one. We urge Marylanders to please get vaccinated just as soon as you are able to. These vaccines are proven to be safe and effective and are provided at no cost. Getting vaccinated will help keep you, your family, and your community healthy and safe. Our daily positivity rate, 7-day positivity rate, and case rate per 100,000 are all down slightly today, and our number of new cases dropped significantly. Maryland is in better shape than the country, and we're not in the red zone. However, nearly all of the states to the north of us are, and we all know that the virus does not respect state borders. We are literally in a race between the vaccines and these new highly transmissible variants, which are driving an increase in new infections and hospitalizations, particularly among younger people in states across the country. Getting more people vaccinated as quickly as we possibly can is our absolute best defense against these variants, and it's the best way to win this long war against this deadly virus. I want to close by thanking all of the vaccinators on the front lines, the nurses, the Maryland National Guard soldiers, the Maryland Responds Volunteer Corps, and all of our clinical partners who are working around the clock each and every day to get more shots into more arms. It's thanks to them and all of their efforts that Maryland is vaccinating at a faster rate than the nation and most other states. And with their help, we will continue to do so in the days ahead until our job is completed. At this time, I'm going to turn it over to Dr. Delbridge, who's going to talk more about why it's so critically important for all Marylanders to get vaccinated. Doctor?
Good afternoon, and thank you, Governor Hogan, once again for your continuing attention and leadership during this unprecedented ongoing public health emergency. For more than a year now, we've been responding to the crisis, and our tactics have been multifaceted, involving every agency of state government, local health departments, hospitals and their healthcare systems, healthcare clinicians, literally heroes of all sorts, public safety personnel, and others. However, our job is not done, far from it. As of today, there are more than 1,100 Marylanders suffering from COVID-19 in our hospitals, and 22% are in an intensive care unit. We must all continue to do our parts by wearing a well-fitting mask that covers our mouth and our nose when around other people, by maintaining physical distance from others, by washing our hands frequently, and if we're not feeling well, taking the initiative to stay away from work, school, and other public places. However, we know that our best strategy to combat COVID-19 is through vaccination. Efforts to vaccinate Marylanders involve hundreds of people who are working every single day around the clock. And we can tell it's working. In the past 5 weeks, the proportion of new COVID-19 cases affecting people 60 years and older has decreased by 30%. They also represent a lower proportion of hospitalized patients. These are the people who were in the first waves of vaccine rollout. The flip side, however, is that people younger than 60 years old are comprising a higher proportion of new COVID-19 cases and hospitalizations. This is one factor in the efforts to broaden the eligibility for vaccinations to as many people as possible. Every vaccinated person is a success. We know that some people still have questions about the COVID-19 vaccines. For example, do they work? Yes. They are 94 to 95% effective in reducing the risk of becoming sick or developing serious illness from COVID-19. Can I get COVID-19 from the vaccine? No. None of the current vaccine uses the virus or any part of it in a way that could potentially give someone COVID-19 through vaccination. Some ask, I want to make sure it's safe. How do I know? Well, millions of doses of vaccine have been administered, and initially to older folks who are often more frail and vulnerable. The safety record of the vaccines has been excellent. Estimates are less than 5 people in a million may develop a self-limited reaction that can be easily managed. Some say, I've heard there are side effects. Are they severe? Some people may get mild symptoms that last a short time. These are not from the vaccine per se. They are actually from one's own immune system revving up to attack the virus when they see it for real. And for some, the posture is maybe I'll just wait it out and take my chances. And there are several reasons why that is not a good plan. COVID-19 is a serious illness, as we've learned. More than 8,300 Marylanders have died from COVID-19. More than 418,000 people have been affected. More than 37,000 Marylanders have been admitted to a hospital. Many people have lasting effects and do not recover completely, if ever, for months. Even if you're a lucky person and you manage not to get so ill, the people closest to you, the ones you love and your friends, may not be so lucky when you pass the virus along to them. And every time the virus moves from one person to another, it is its chance to become a better virus, to be stronger, to make people more ill, and to resist or avoid the treatments that currently exist. As baseball season is starting, I thought I would make a baseball analogy, and those who follow the Orioles, the Nationals, or their other favorite team will understand. The best way to stop a run from scoring is to get the batter out before he gets on base. No base runners means no runs can score. If COVID-19 can't get on base, can't go from one person to another because they've all been vaccinated, we win and the virus loses. On behalf of all of us throughout Maryland who have been in battle for more than a year, please do these things. Wear a mask, keep your distance, wash your hands, stay at home when you're not feeling well, and please, most importantly, get a vaccine when it's your turn. Thank you.
With that, we'd be happy to take a few questions.
Governor, Dr. Delbert just said that the spread right now is particularly concerning amongst young people. So a question about the reasoning behind the 16 and up registration. How much of this was weighted on progress that you have made on the vaccination groups that have been existing previously? And how much of this is a real concern about these variants spreading amongst young people, and then those young people in turn spreading it to the wider population?
Well, it's a great question. So it's a little bit of both. We certainly took this into consideration. We're now able to move more quickly because we've been getting that increased supply and we've built the infrastructure. We saw this coming, which is why we started the pre-registration last week to get ready and geared up. With the response has been phenomenal, and we were able to handle all of that, all the mass vac sites. But there's no question, as Dr. Delbridge said, we're seeing fewer and fewer of our older residents getting sick or hospitalized or dying because 76% of them have been vaccinated. But we're seeing the increases that we are seeing. Today the numbers were pretty good, but we've been bumping along here, slight increases. It's mostly younger people, and we're starting to see hospitalizations among people in their 20s and 30s and 40s as opposed to just folks in their 70s and 80s and 90s. So getting more people, younger people, vaccinated faster is certainly a goal, and we want to make sure that people take it seriously. Some younger people sometimes felt that they were bulletproof or they didn't have to worry about it. But now, we're seeing that they really do need to worry about it. And so we're hopeful that everybody will be signing up and getting vaccinated.
Governor, you're opening up the state fully to vaccinations nearly a month ahead of the schedule proposed by the president. Looking at that, do you have a goal in mind? I've asked you this before. Do you have a goal in mind for the number, the percentage, the raw number of Marylanders you'd like to see vaccinated by the July 4th weekend?
I'd like to get as many of them as we can. It all depends on the supply. Now, the federal government has gotten us an increased supply. They're saying that's going to continue. They don't see any more dramatic increases, I don't think, for a while, but same kind of supply that we're getting. At this pace now, as I mentioned, we just hit 75,000 a day. We'd have to get more supply from the feds to hit the magic 100,000 a day number that our system can handle, but we don't have enough vaccines for. But we can get that every day. Our averages are going up. Again, we're ahead of most other states. I'm really pleased with the progress. But so we went to 76% of all the people over 65. We should be over 80% by the end of this week. We're at 46% of all adults over 18. That shouldn't take us very long to get to half that population. So I think I don't want to make promises we can't deliver based on something that's not in our control. But if they continue to provide vaccines the way they have led us to believe, we should be able to finish everybody who wants one, during April and May.
Speaking of supply and expectations, avoid the challenges that there were in January, over months.
Well, in January, there weren't enough, and we didn't have an infrastructure built. But, we're not, as I said in my remarks, every single person that's over 16 is not going to get one immediately. But we do believe that over those next few weeks of April and May that we will have enough vaccines for everybody, and that's why we're trying to get an organized process. We don't want to slow down. We want to keep ramping up. So it's not going to be instantly, millions of people tomorrow are going to be able to get one, but over the next several weeks they will.
Are you concerned with the cost of walk-ups?
No, we're hoping for that, actually. I mentioned on Thursday afternoon that we were going to have an experiment, our first trial of opening up a walk-up line in Salisbury, and 500 people the next day utilized the walk-up line. It went terrific. It was very smooth. We hit our record numbers this weekend in Salisbury at full capacity, and we're expecting the same thing to happen in Hagerstown and at all of our other sites moving forward. So, it's still best because if you register, they have all your information, there's a vaccine for you. It's very smooth. I mean, people are just raving about the process at all these sites. The walk-up, you can't be guaranteed because if too many people show up, you may wait in line for a while and they may say, sorry, today we don't have enough. But a lot of people are going to be able to get handled that way.
A good part of your messaging today, Dr. Delbridge, is continuing to tell people to get the vaccine. How concerned are you about flagging demand at this point? I mean, when we see there's availability for walk-ups in Salisbury and Hagerstown, why is that such a big part of your messaging? Are you already starting to get indications? I asked this obviously before, that demand is flagging.
Well, there's no question about that, and it's because when 76% of everybody that was eligible got a vaccine already, that remaining 24%, some of them don't want a vaccine. So that's why we're opening up to bigger and bigger groups. Our goal is to eliminate and wind down and shut down all of these 12 mass vac sites so that the few remaining people can get it at the CVS or Walgreens or Giant or Walmart or their doctor's offices. But in the meantime, we want to run as many people through there as we possibly can, thousands of them a day, because time is not our friend in this battle. And so it's this, as we've said before, we have 3,000 points of distribution. Now we're up to 485 pharmacies. We started with a pilot program of 30. When people can get a vaccine pretty much anywhere, eventually they're going to say, why do we want to drive to a mass vac site and wait? But right now we need all those spigots opened as much as we can. But the demand is going to decrease, and I've said this since January that for January and February it was like, why can't we get enough vaccines? Why can't we get an appointment? And that it was going to switch to, we have vaccines, we have appointments, we need more people, and that's already starting to happen. I think we're going to adjust that now with this opening of the floodgates, but after a few weeks, that's also going to start to slow down. Anybody? Tom?
Yeah. Question about restrictions, Governor. One of your previous slides showed the red states and the not red states, and a lot of us were in the room a year ago when you announced the very first state in Maryland. The CDC, we bordered those states. How large of a role does what we see on that map play in your future decisions on restrictions here in Maryland?
Well, we watch it very closely. Our team is talking every single day about what steps we need to take. Dr. Delbridge hit the nail on the head when we said the three most important things is wearing the masks, which we still have a mask mandate, although more than half the states don't. We still do. The distancing and getting the vaccine. So we're doing a better job on the vaccine. We still have the mask mandate. Well, we're still pushing all of those things that kept us safe. It doesn't appear to have anything to do with openings because New York has got most things closed, and it's, I think, the worst. Florida's got everything open. They're right behind New York. We're in between in that right now pretty good spot. We're less than the national average. We're less than the regional average. We're better than all of the states to the north. But it's not great. I mean, it's not going down the way it was. Our positivity rate, daily positivity yesterday dropped back below 5, so that's good. But that was only for one day. The 7-day average is still over 5. Those states on the case rates, per 100,000 that are in the red. We're not one of them. Luckily, our case is, it's hard. You can't really judge one day to another. Sometimes people say, oh, it went up today. Well, today we dropped 850 cases. We went from 1,600 down to 850, which is one of our lowest days ever. So you have to look at a trend. We're continuing to watch that, and we're going to make decisions every day, based on whatever the facts we see on the ground, not just in our state, but what's happening in the rest of the country.
The contact tracing reveal why some of the hospitalizations are going up and positivity rates.
Maybe, I don't know if Dr. Delbert wants to talk about, no, he doesn't want to talk about that. That's not his real thing, so I can wing this one then. We don't see a one definitive thing, but we're still seeing the things we've talked about for a long time. We have almost none of it has to do with restaurants and bars, although there's breathless coverage about we shouldn't have opened anything. By the way, we don't have anything open at 100%. We have distancing requirements that most places can't even get to 50%, and we still have the masking requirement. But most of it is still family gatherings and working outside the home, mostly in offices, and travel. And when you've got states that are really high and people are traveling there a lot, we had huge amount of people traveling over Easter, but even in the weeks before that, spring breaks all over the place. And those things are much more concerning to us.
Last question. Looking
Can't
at
see.
the audit from Friday about the test kits, do you have a response to that, or the state?
Not really. I mean, we have nothing much more to say about that. It was, complete nonsense. I'm still very happy with the tremendous success of acquiring these test kits. It was probably one of the biggest accomplishments throughout this pandemic. The report was partisan nonsense. We used every single one of the 500,000 kits. It was tremendous. We were the only state in the country to acquire any of them. It was unanimously approved by the Board of Public Works. And I don't have much to say about the report, and I wouldn't change a single thing. Don't really care what those legislators have to say. Thank you.
All right, that was Governor Larry Hogan with the major announcement that starting tomorrow morning, all Marylanders 16 and over can get a vaccine at one of the state's mass vaccination sites.
And 16 and 17, but keep in mind the FDA is only approving the Pfizer vaccine for that young age group. But he says as of tomorrow, everybody over the age of 16 in the state of Maryland can go ahead and register. However, they're still taking the age groups from priority 1 and 2, actually scheduling for the vaccine before the 16-year-olds.
Yeah, and your best option is still going to be to pre-register on the state's website, covidvax.maryland.gov. However, they are opening more mass sites that will have walk-up appointments, no appointment necessary. You just walk right up. So that began last week in Salisbury. The governor saying that was very popular. 500 people showed up the next day. And beginning tomorrow, that will be possible in Hagerstown and starting next week at M&T Bank Stadium in Baltimore.
And the governor also says that the reason why they're moving forward and increasing the people who can receive the vaccine is because they're now seeing an increase with the 20, 30, and 40-year-olds actually seeing hospitalizations, where 76% of Marylanders over the age of 60 have been vaccinated. We're seeing a decline in terms of that age group receiving any fallout from the vaccine. So the governor wants everyone to still wear your mask, social distance. We have a reporter on the scene, and we will have the latest for you coming up on WMAR-2 News at 5 o'clock.
And you can always find the latest on our website, WMAR2news.com. Also be sure to download our app for the latest information. Thank you for joining us with Kelly Swoop. I'm Mallory Sofaste. We'll send you back to regular programming.